It was paused, but
Oh, okay, great.
we'll give everybody a couple minutes to get in here. Couple more. Hi, everybody. Thanks for filtering in here. We'll get everybody in the room here as people start to join. So if you're wondering if you're in the right spot, you are. If you're here for NeuroNights, this is our second session in the month that we're kind of going over sports and physical activity. Tonight we're going to be learning a little bit more about how to do this intensely and the benefits of doing your physical activity intensely. So we'll go ahead and get started here. So today we have Dr. Meredith Banhos. She's a physical therapist and board certified neurological rehab professional. She is kind of overseeing a lot of the education that is provided over at Dodd Hall for folks that are leaving inpatient rehab and going back into their homes and downstream to outpatient rehab as well. And so this is a really cool opportunity for us to kind of get a sense of what that patient education would be like, what you would hear if you were in the hospital today, and maybe not even hear if you were in the hospital today, because not everybody's getting a chance to do that. So I'm really excited for this one. So Meredith, why don't you go ahead and just take it away?
Great. Yeah, thank you. And thanks for this opportunity. Interestingly, the topic I'm going to speak about tonight, the research surrounding it is actually for people that are greater than 6 months post brain injury. So a lot of this might be applicable to some of you on this call. And I hope that it is. Pull up my slides here and share it with you guys. Okay, are you seeing slides?
Yes.
Okay,
Yep.
great. Okay, so I'm going to be using the phrase intensity initiative a lot tonight, and that is an initiative we have going on specifically at Dodd in our inpatient rehab facility at Ohio State. But I'm going to talk about it in more generalized terms as well, so that hopefully each of you can take something away from this tonight and apply it to your own lives if you would so choose. So by the end of tonight, some of the objectives following this discussion is that I would hope that each of you on the call would be able to describe what some of the recommended exercise intensities are and how that can promote improved health, particularly for people that are survivors of brain injury. It would be a very important skill, and you'll see why related to this, that you would be able to learn how to find your own heart rate if you don't already know how to do so. I would like for people to, by the end of this discussion, know how to calculate their target heart rate so that they can adhere to these exercise recommendations that we'll be discussing. And if we're not relying solely on heart rate, I would like for people to learn other ways of monitoring the intensity at which they exercise. And I hope by the end of tonight that each one of you could think of at least one different activity in your life that you might be able to perform that would help you achieve the recommended exercise intensities. So with that being said, a lot of what we're discussing tonight is specific to a clinical practice guideline, a CPG, that is based on research, and this is published by the Academy of Neurologic Physical Therapy. So just this year, in January of 2020, the clinical practice guideline that was published that was specific to people with chronic brain injury, spinal cord injury, and stroke. And when we say chronic, again, we're referring to people that are greater than 6 months post their initial injury. And this clinical practice guideline suggests that if people are to improve their independence and their outcomes with walking which we know is a big deal for people that have had similar injuries to this, that those persons benefit from doing moderate to high aerobic intensities to improve their walking. In addition to this, along sort of in parallel with the clinical practice guideline, the Academy of Neurologic Physical Therapy also has started a national campaign this year, which they have titled Intensity Matters. So this campaign is a way of promoting that irregardless of what activities you're engaging in, the more intensely you perform them, the better your outcomes are going to be. So this is very relevant to us as therapists, to persons that are survivors of brain injury. We know that if we're going to be doing an exercise or some sort of activity to promote wellness, the more intensely we do it, the better our outcomes are going to be. So the clinical practice guideline specifically gives us some recommended intensity levels, and those are here in red. This 60 to 80% of your maximum heart rate. If we are achieving that level of intensity 20 to 30 minutes a day on most days of the week, so preferably 5 days of the week, we know that this improves people's outcomes, specifically as it pertains to walking. So they might have a faster walking speed, they might be more independent with walking, they might be less reliant on a caregiver, they might be more likely to be a community ambulator versus someone that's limited to household ambulation, etc. These same exercise recommendations that are listed here, 60 to 80% of your heart rate max, 20 to 30 minutes a day on most days of the week. These are very similar to the American Heart Association recommendations for any healthy adult or individual for exercise and fitness. They're very similar to the same recommendations of the American College of Sports Medicine's recommendations for exercise and fitness, and for the CDC, the Center for Disease Control. So the good news is we, as a survivor of brain injury, we should be exercising, whereas perhaps, a couple decades ago, it was a bit taboo for someone with a significant chronic injury. We might not have thought that we should be participating in exercise and fitness the same as most people. We should be. And not only that, we should be achieving the same levels of exercise and intensity that other people are as well. And we know that there are tremendous health benefits associated with this level of exercise. So here I have listed out the first bullets here are specific. These come from the American Heart Association. So we know if getting this 20 to 30 minutes of exercise in on most days of the week, we have a significantly lower risk of heart disease, stroke, diabetes, high blood pressure, etc. We know that getting this amount of exercise helps with improved sleep, with improved cognition. It helps us maintain our weight, better bone health, better balance, fewer symptoms of depression and anxiety, and overall a better quality of life. And that's just for an average healthy adult. And certainly we know that many of these comorbidities are associated with chronic brain injury. My last bullet down here is specific to the Academy of Neurologic Physical Therapy. So they have done research and know that people that achieve these levels of exercise, which is the same as the American Heart Association's levels, that very specific to those with chronic brain injury, if they achieve this, we see improvements in cardiovascular capacity and efficiency. And most importantly, we know that they have improved neuroplasticity, which means that there's that improved healing and neurologic benefit specific to those that have had an insult to their central nervous system, their brain or their spinal cord. So there's very profound, convincing research out there supporting that just this level of exercise can really help tremendously with a lot of health benefits. So at Dodd, specifically in our inpatient rehab, we have taken these exercise recommendations, as well as the information from this clinical practice guideline and the movement that has come about from this national campaign, Intensity Matters. And we have purchased heart rate monitors, which is the ones that we've purchased are similar to this pictured down here, which is a chest strap. Oh, I guess it's on this man here, that monitors your heart rate. And we have these devices synced with the patient's bedside tablets, that every patient that comes through Dodd is loaned a tablet and can also be loaned one of these heart rate monitors. These are off-the-shelf commercial devices, and we download a free app, the Polar app, and it helps us to monitor patients' heart rates in real time during their exercise or during their therapies so that we know how intensely they are working. We also have an IRB research study associated with this. So we're hoping our hypothesis would be that those patients of ours that achieve the 20 to 30 minutes in their target heart rate zone 5 days a week, we would expect that they would have improved outcomes in comparison to those who might not achieve it for whatever reasons. So we're hoping to publish some information after we go through this study. And also, I'm not sure if anyone on the call is still in therapy, still in our health system, but we're trying to spread this across our entire continuum at Ohio State. So some of our outpatient therapists have become very interested in this initiative. And the thought would be that we would train people in using these devices and other similar equipment to this to monitor their fitness level, their exercise, and that if they would then transition on to our outpatient facilities, that our outpatient therapies would follow up with you and make sure that you're staying on track with your exercise goals. So very exciting stuff for us. My next slide is just a screenshot to show what a workout would look like. So we threw a heart rate monitor on someone and it tracks their heart rate in real time while they're doing whatever therapy we have lined up for them. And let me see if I click here. It produces this very nice visual that shows us each of these different bars is a different percentage of someone's heart rate max. So the blue, the green, and the yellow is our sweet spot. That's between 60 to 90% of someone's heart rate max. It also calculates it down here. So it shows us that this particular person, if I would add up the blue bar, the green bar, and the yellow bar, this would tell me how much percentage of their therapy session they spent in the target heart rate zone. So it's just a very nice visual. It's very motivating for people to be exercising and to see in real time where they're falling within this intensity category. And it's very good for self-efficacy. Someone really knows how hard they are exercising based on this visual feedback. And I'd like to say I'm not particularly motivated or promoting the Polar heart rate equipment. That's just what we happen to purchase at Dodd, but there are certainly other devices and other means of doing this. And I'll talk about that in a couple slides here as well. Oops, there go my animations. So if for some reason you would not have fancy equipment, that's okay. Everyone is capable of calculating what their maximum heart rate is, what their target heart rate zone is for each of you as an individual. And I'd be happy to walk through an example here. And even if you guys are close to your cell phones or a calculator, you're welcome to pull those things out right now and we can talk through the equations so that you can calculate what your target heart rate zone is right now for exercise. So it's just a very generic calculation. So we always take the number 220 minus a person's age to get your maximum heart rate. And then per these exercise recommendations, moderate to high intensity would be somewhere between 70 to 85% of whatever your individual heart rate max is. So I gave an example of myself down here. So I'm 35 years old. I take 220 minus my age, 35, to get this number, 185, which is my heart rate max, mine individually. And then I'm going to take that heart rate max, 185, and multiply it by 70%, as well as I'm going to take that 185 and multiply it by 85%. And this is my target heart rate range. So I want to be exercising at approximately 130 beats per minute to 157 beats per minute. So if I'm exercising in that sweet spot, I know that I'm good. And I want to try to accumulate 20 to 30 minutes of that a day on most days of the week in order to know that I'm getting all those health benefits that we talked about on previous slides. So I've taught you how to calculate your target heart rate, but how do you know if you're there? How do you know if you are exercising in that target heart rate zone? So of course you can use any of these commercial devices that are out there, such as the Polar chest strap that I just showed you. Fitbits are of course very common right now. Apple Watches, smartphone apps. There's many, many devices out there that can monitor your heart rate and or count steps or do multiple other fitness tracking capabilities. A simple, cheap way to do it is simply by taking your pulse. So if anyone on the call is unfamiliar with how to do that, a very common spot to take your pulse is right at your wrist. You would sort of, just as the picture indicates here on the slide, take 2 fingers and place it at your wrist, more so to your thumb side than to your pinky side. And you should feel your pulse there. And you would count how many beats you feel in a minute to know what your heart rate is. Now, of course, this can be more challenging to do mid-activity. If you were jogging on a treadmill or on an elliptical, it might be a little bit difficult to get your real-time pulse. But you could certainly, after you're done with an activity, stop for a minute and take your pulse and see if you're even remotely in the range of being in that target heart rate zone to gauge whether you need to be increasing the effort at which you're giving to that exercise, or if you could even rein it back a little bit. And I think most people would be surprised. It's not very difficult to get your heart rate into that target heart rate zone. Some people can do it with just completing very basic tasks in their day-to-day life, like walking up a flight of stairs, or a lot of the patients that we see that are very deconditioned or new to an injury, something as simple as sitting at the edge of the bed might be enough to get their heart rate into their target heart rate zone. So a lot of people are really surprised by how easy it is to achieve these recommended intensity levels. Of course, many people, especially survivors of brain injury, are on medications, and many medications, particularly beta blockers, can blunt someone's heart rate. So if that's the case, that's still okay. Oftentimes you would take that same calculation that we just looked at a couple slides ago, and you would reduce your target heart rate zone, whatever you've calculated to be your target heart rate zone, you would reduce that by about 10 beats per minute. So if my target heart rate zone was about 150-ish, 130-ish to 150-ish, and I'm on a beta blocker, I would then, my target heart rate would be about 120 to 140. So we would just shift it by about 10 beats per minute. If you're on a beta blocker, you might want to check in with your physician, because the different beta blockers on the market have different sensitivities. So some of them might impact heart rate much more so than others. So you could just ask your physician about that, but it doesn't mean that you can't use your heart rate to reliably look at the intensity at which you're exercising. And then there are some people that just can't rely on heart rate alone to gauge their exercise intensity. So for example, someone that has a pacemaker, their heart rate is being artificially paced by an external source, and it doesn't necessarily correspond to how intensely they're exercising or not. Or some people, for whatever reasons, whatever medications they're on, etc., might not be able to rely on their heart rate to determine how hard they're exercising. So on this slide, I have two different scales that are very common perceived exertion scales. This first one over here is called a modified Borg exertion scale. And on this scale, the corresponding levels to those recommended exercise intensities, moderate to high intensity, would be anything from 14 and above. And then we also have this scale that we're using at Dodd for people that were unable to rely on their heart rate to monitor their intensities. We use this 0 to 10 scale, and we expect that people are exercising at somewhere about a 7 or above. And of course, the disclaimer is when in doubt, check it out. So you should always check in with some sort of a healthcare provider prior to starting an exercise program, especially if you have concerns about your heart rate or anything like that. You would just want to make sure that you're cleared to exercise before trialing any of this. And good practice would be that you're monitoring your heart rate, blood pressure, oxygen saturation level prior to exercise, ideally if you could during exercise to make sure that nothing's going crazy, and then again after exercise just to make sure that things are nice and safe. And a healthcare provider could help you do those things prior to you getting initiated with an exercise program. So my last several slides here are just suggestions of ways that people can achieve moderate to high intensity exercise. And this first slide I have right here is perhaps for those that are more able-bodied, that don't have as many physical barriers to performing exercise. So something as simple as walking someone can easily achieve moderate to high intensity exercise just with walking. So again, I like to teach my patients that there's often a stigma that exercise, moderate to high intensity exercise, means you have to be running a marathon, and you do not. You can be walking on a treadmill at 2.5 miles per hour, and that's usually enough to get someone's heart rate into this target heart rate zone. I included a couple progressions here. If for some reason that's not enough to get someone's heart rate up, you could, of course, walk up an incline. That would be much more challenging. You can always add weights, whether that be ankle weights or if you're carrying dumbbells, or some people have weighted vests. You could push something to give yourself some resistance. You could pull something. You could be walking in water to increase the resistance that you're experiencing. Another great exercise would be doing some sort of cycling, whether it's on a recumbent bike or a stationary bike or an actual bike. For those that might be wheelchair bound, for example, an arm bike is enough to get your heart rate up. Swimming is an excellent exercise. This last one I listed here is something I stole from one of my coworkers. He had one of his patients practice getting down on his knees, getting down on the floor, and then getting back up. And just that task in itself that he did repetitively was enough to skyrocket their heart rate up into that target heart rate zone. So it doesn't have to be anything crazy powerlifting or anything like that. You might be surprised how quickly you can get into that target heart rate zone. And then here's just a couple examples of exercises for people that might need adapted considerations. So any big arm movements. So just simply like swinging your arms could be enough to get someone's heart rate up. Sitting and doing punches, again, you could always add resistance, add weight. Anytime you increase the speed, that's going to increase the challenge and the intensity at which you're working. Some sort of adapted push-ups, whatever that means for you based on your physical capabilities, pushing up from the armrests of a wheelchair, leaning against a surface at your chest height and going in and out. If you're capable of getting flat on your belly and trying to push your chest up from the floor, that sort of thing. All of these are options for increasing your heart rate. Propelling a wheelchair, pushing on the push rims of a wheelchair, any sort of adapted sit-up, whatever your physical capabilities are. All of these things would be options for you. And then of course, there's the whole spectrum in between, just based on what your physical capabilities are. I think I'm in these last couple slides here are just examples. If anyone's having difficulty imagining any of these adapted exercises, these are images from one of our patient education resources. One of our physical therapists created an adapted exercise program for wheelchair users. And so here's just an example of what an adapted sit-up might look like for someone. This next slide is just seated punches, and it looks like this person doesn't quite have great grip capability or full function of his wrists and fingers. So he's got weights strapped to his arms and he's just working out in that manner. And this last one, it wasn't a perfect picture what I was trying to capture, but this person is leaning forward and sitting back and using their trunk. But it also reminded me of a way that you could do an adapted push-up if you wanted to lean forward on some sort of a surface and practice pushing up and down just to engage as many of your muscles as you can. So I think that's the end of me talking at you guys. And I'm happy to answer any questions or open up discussion from here.
Well, thank you, Meredith. This is a good overview and I think very, very clear in terms of what we want to try and get to. So, yes, if anybody has any questions, just feel free to unmute and ask. I have a quick one while folks are maybe thinking about what they'd like to ask. So, it seems like a very general target, right? So you've got, you've got the heart rate zone that you're trying to get to. There are many ways that you can get your heart rate into that zone. It doesn't really matter what you're doing necessarily. You're meeting yourself where you're at, but the only goal really is to make sure that your heart rate is in that right zone. So
Correct.
What if I have maybe specific goals, right? So I can think about my endurance or my stamina is too low and I'd like to get better at that versus I feel like I've gained too much weight and I'd like to lose some of that. You always hear like there's a cardio zone and there's a fat burning zone, right? How does this play into that, and how would you suggest people consider those things?
Sure. So these recommendations that we talked about just now promote those things that we discussed. So it helps with all of those the associated health benefits, et cetera. helps with neuroplasticity, specifically in persons with chronic brain injury. However, if you're trying to do something very specific like lose weight, you would need to do these recommended exercise intensities plus a little bit more. And those things are very clearly spelled out on the American Heart Association's website. So that's a very easy resource to look at. It's very user-friendly. You can find information very quickly and very easily. But just as an example, I think for weight loss, you would want to be pushing more so that high intensity. So perhaps exercising closer to 85% of your heart rate max. And I think they suggest something closer to the maximum, like 30 minutes a day, most days a week. So it's still similar recommendations. It's just maybe more so on the higher end of those things is what you want to be pushing for. But if that is your specific goal, I would go to the American Heart Association and look at what those specific indications are and go from there. I like what you said, Kedar, as far as meet yourself where you are. So maybe a good message to take from this is first and foremost to just start monitoring your intensity, not even setting a goal for yourself yet, but just monitoring it. Because how do we know, are you achieving those exercise recommendations already in your day-to-day life without even knowing it? And just sort of when you know what your baseline is, maybe challenge yourself to go to that next level from there.
Great, thank you. Does anybody else have questions?
I was just going to use a recumbent exercise bike, and it's got you can monitor your pulse rate with it.
Oh,
I don't use that very much though. I ought to try it though. But it would make it, and I'll keep your figures in mind.
Yeah.
I need to get in the habit of doing something. I'm sitting around too much.
All of us do.
You're right. Now COVID-19.
I'm in the same boat. Yeah.
You're right. On top of it, right, it was already bad before that, and that just like, it went out of control.
Mm-hmm.
And Perry, you said something about so you've got the recumbent bike and you've got a heart rate monitor built into it, right?
Yes.
Okay.
I don't know if it works good though.
That's my question is, do we feel like those are really good or good enough? I know that last week we talked to Jackie about sort of how to do that and sort of the importance of being pretty close or accurate with those. Meredith, do you have any thoughts on?
Yeah, there's a whole spectrum of devices that are good and devices that are very much not reliable.
Right.
But that's where, I think just having a little bit of knowledge, which you all should feel like you have right now, you can gauge that. So if you feel like you're exercising at an 8 out of 10, that you're really exerting yourself, and you have your hands on that recumbent bike and it's saying that your heart rate is 60 beats per minute, that's very low.
Right.
You might then at that point
double check it.
Take your own pulse and see if your pulse is giving you a higher reading than what that monitor is.
Right.
And there are, so the ones that we have, the polar chest straps, are one of the more reliable devices that are off the shelf. So that's why we purchased it at Dodd, just because we were doing a little bit of research surrounding it, et cetera. But some of the devices that are a little bit less reliable.
They dropped in price a lot. I've seen some of them, and not the straps, but the watch, the Fitbit watch, that kind of thing.
Yep. The Fitbits, the Apple Watches, they're a little bit less reliable. But nonetheless, I still think they're a helpful tool because they at least give you a gauge of, am I increasing my heart rate or am I still down here just in my resting zone? So nonetheless, you just want to know, am I raising my heart rate or am I just hanging out too low here?
Okay. So just making sure, that's what I love about the sort of the adapted scales that you have. It doesn't really matter what the number is if you can if at least you can get to that place where you feel like it's intense.
Mm-hmm.
Any other questions out there?
I have a question. This is Carol.
Hi, Carol.
Hi. So I'm calling, my daughter has a brain injury, and she's 14 years since her injury, and she's recently finishing up her bout of physical therapy.
Mhm.
And so the premise from what I understand you're studying is, if you bring your heart rate up to this zone, any focused physical therapy will be more successful with meeting that heart rate. Is that right? Am I understanding that right?
That's correct. That's what, in this instance, I'm sure there's some exceptions, but a lot of the research is pointing to, very generically, more is better. So just a basic task, for example, like, I'm not sure an activity she'd be working on. Let's say it was transferring in and out of a chair. In this instance, doing that one repetition one time and not really getting someone's heart rate up would not have as many health benefits associated with it as if you would perform that task multiple times with an added cardiovascular challenge, whether that means you're doing it while you're weighted or increasing the speed at which you're performing a task, etc. If you're challenging your body cardiovascularly, there are going to be better health benefits associated with that than if you weren't doing that.
Okay, so in her situation, she's working on balance and core strength for walking. And she does walk, but she sometimes loses her balance. So they've broken down some of the steps, and it seems like it's hip, swinging her hip too far out. So it's controlling the hip, and she has some specific exercises to engage her core and to work on her hip movement and to not lock her knees. So should she be working on doing these so that her heart rate increases to the level that, that's recommended? Or should she be doing things that are, things that bring up her heart rate, and then the exercises will be more specific, more targeted?
Sure. So per these recommendations, the clinical practice guidelines and what we know based on the research that's been published, the best medicine for her to regain walking capabilities is walking. And we know that the best outcomes occur when that walking is done intensely. So I don't mean to oversimplify it, but if she's up with her therapist and working on walking, she is going to have the best outcomes if while she's walking, she's achieving that target heart rate zone compared to if she were doing it at a lesser intensity.
So walking fast or walking a lot?
This is Margaret speaking now, my daughter.
Hi.
Did you hear her? I don't know.
I heard her, yeah.
Okay.
Yep.
It just depends on how an individual's body responds. So walking fast, yes, that should increase your heart rate compared to someone that's walking slower. Walking a lot, yes, that should increase your heart rate compared to someone that's not walking very much. So whatever combo gets you into that target heart rate zone, if you're accumulating that 20 to 30 minutes on most days of the week, that's when you will have the most health benefits and the best outcomes.
Oh, wow. Okay. I should have added that I use forearm crutches.
Mhm.
So, would you still say 20 to 30 minutes of walking? I mean, because walking with forearms, according to the internet, says that it burns like 40 to 60% more of your heart rate.
I would imagine you would get into that target heart rate zone much quicker because you're using all 4 of your extremities. So the recommendations are still the same. You might just meet those recommendations much quicker than someone that's not using forearm crutches.
Oh, okay, okay.
So it'd be interesting for you to monitor your heart rate while you're walking and see how quickly you get up there.
Yeah, it would. Okay, thank you.
You're welcome.
Good questions.
Thanks.
And then, well, let me open it back up. So, does anybody else have questions?
I have a question.
All right, go ahead, Marcus.
So I've had 2 brain surgeries, some like, I think 20 years ago now. And I still deal with right side weakness and a foot drop. My toes don't move, and but so I'm into like hiking and backpacking, and I've developed like a pain in my hip, and like I'm only like 38, and they said that I'm like at risk for a hip replacement and all these things, and I did get a foot brace, like a flexible one for active people, but I lost like 3 inches of muscle mass on my leg, and I just stopped wearing it. But now it's like whenever I hike, I find myself leaning on my left side, and then the like the muscles get tight and tendon, and like I'm risking injury. But I don't want to give up backpacking because I enjoy it and it keeps me active. But I mean, will those muscles ever come back? Can I train them? Because they are smaller than my left side. Will ever will that
So that
ever
just
be better?
that sounds like you've developed a couple orthopedic injuries related to your exercising. So I would suggest getting back to one of your healthcare professionals and seeing how they can help you so that you can get back to doing the things you love doing.
Okay.
All right, does anybody else have a question? All right, so I have one here. So some of the things that we've talked about in these sessions before have not just been about physical wellness, right? We've talked about social wellness, mental wellness, and so on. And so some of the things that we've been talking about within those have been things like mindfulness. We've done yoga, and talked about sort of the benefits of that, how to do that. And I kind of see some overlaps, right? So one place it's, for something that's a little bit more gentle, yoga or something like that, it's not really something that you would approach all the time as intense. Um, do you see that these recommendations should still be followed there? Um, and, or are there different approaches to this? Or do you see maybe this exercise is one type of thing that you do and that type of exercise or practice as something else?
I agree with the latter part of your statement there, Kadar, that this is a tool to help promote wellness, fitness, reducing comorbidities, that sort of thing. There are certainly other forms of exercise, other things that you can take on, such as mindfulness and, taking care of your mental health and that sort of thing as well. That are other tools in your toolbox.
And so going along with that, and because we've talked about mindfulness, do you feel like these types of approaches in exercise, when you're really focusing on your heart rate or you're really focusing on the metrics, uh, you know, do you think that takes away some of the mental benefits of exercise, or do you think that that's, maybe a little immaterial, that they're still pretty good?
No, we've just anecdotally found it to be very motivating to people. Typically, people respond really well to goal-oriented tasks. So if we say, exercise, keep your heart rate in this bar on this screen, people are very motivated by that. And sometimes that distracts them mentally from the actual task of I'm exercising right now. And sometimes we find it to be very beneficial, and that people, if anything, respond very well to this sort of thing.
Oh, that's cool. That's cool. And
I can see what you mean if you're just trying to clear your head and go for a run
right.
or whatever. Does it detract from that? And that's a good proposition, but I've not seen that so much.
Well, that's good to hear.
Yeah.
Any other questions out there? I've got a whole list, so we can keep going.
Does anyone feel like they're actually achieving this in their day-to-day life?
Yeah, that's a good one.
Not, I hated to say that. I need to become more focused. I don't have the energy, but that's medicine, I think, more than anything, believe it or not.
It's interesting because, I preach this day in and day out, and it's not until recently that I've actually gotten a heart rate monitor for myself and my husband. But even just thinking, how do I answer that question? We put it on ourselves when we're exercising, but I don't track my heart rate throughout my entire day. So I'd be curious myself to know, how much do I accumulate in a day's time? And, where does that land me on that recommendation?
I have a suggestion about like exercise motivation. I don't know if it's super healthy, but if anybody's ever tried pre-workouts, they're like when you take them, it's almost uncomfortable to just sit still. And so, once you take one, it's like, all right, now it's time to work out, because you have all this energy. It's a lot of caffeine and things that like dilate your blood vessels and stuff. But I find that very, very motivating, just because you're just kind of sitting there tweaking out on caffeine and you need to do something. And I find that helps me keep exercising even when I don't want to. I don't know if that's helpful.
What do you think, Meredith?
That might be an instance where you don't rely on your heart rate. Caffeine's probably shot your heart rate up and you don't even need to exercise.
But it does get you moving though. And like you can turn what you intended to be a short workout, like my workouts, before I know it, they'll be going past like an hour or more, and you still have more energy and just keep going. And it's motivating.
That's cool. I will tell you, my motivation is just looking in the mirror. So I can do that and keep going. So this kind of brings up a point though, so Marcus, that's a decently long exercise, especially if you're doing that routinely. And I'm curious to think, for brain injury, just the general public, probably there's a lot of range to this, but in brain injury, is there, what are those negative consequences of exercise or over exercise? Of course, you can be injured or you can risk injury, but are there other issues that we would want to at least keep an eye on?
Sure. Again, you would want to check in with a healthcare provider, especially if you have cardiac issues. There is research. First of all, there's research that has looked at what are therapists' barriers to getting their patients or the people they're working with into these target intensity levels. And one of the most common barriers from a therapist perspective is they're afraid that they'll do harm to their patient, or they're working with higher risk populations to begin with. Is it really safe to be exercising at these moderate to high intensity levels? And it is safe. The risk of having an adverse event or something bad happening in response to exercise is so small that it, the risk of not doing this exercise outweighs that that small percentage of a risk that something bad could happen. So there's publications on that. There's that in itself is trying to be promoted amongst healthcare workers, that don't be so afraid to exercise people and get them up and moving, because the benefit of it so outweighs the potential risk of something bad happening. So I think that's very comforting and reassuring to hear. People are afraid to exercise. They're afraid of, something bad, like a heart attack or something horrible like that happening. Really, I think the greater risk is, like you mentioned, Kadar, something orthopedic, or like something Marcus was describing, hip pain, or you throw yourself off and you injure something else. That would be more so the risk than something really bad happening.
Okay. So I don't have as many excuses as I thought I did.
I know, sorry.
All right. I think we can take one more question if it's out there.
I have a question.
All right, go for it.
This is Margaret. I have the TBI. I was wondering if it would be like, because you guys are talking about heart rate up and stuff, would it be get it up and then keep it there for 40 minutes or 30 minutes, or just get it up and then once it's up, it would just like, so that helps the stuff you do after that. Does that make sense?
Let me see if I know what you're getting at. I didn't mention that you can accumulate this throughout your day.
Oh.
Just because the recommendation is 20 to 30 minutes a day doesn't mean that you have to do it in one bout, 20 to 30 minutes in one session. So you can accumulate 5 minutes here, 10 minutes there, 15 minutes later. The health benefits still present themselves so long as you're accumulating that throughout the day. It doesn't matter whether you do it all at once or whether it's spaced out.
Oh,
You're
wow.
20 to 30, not 40 minutes also. I mean, that's, a shorter range that you would need to work in.
Does that answer what you were asking, Margaret?
I think so. Well, because like my training in the past, I thought like I have to get it up and then keep it at that level and keep going. Like I have a recumbent bike, and like I thought I had to like go up a hill, and then I'm like, well, when I go down it, it will not be a high heart rate anymore. So
I think I see where you're going with this, Margaret. So the idea being like, let's say that I'm working out for a 20-minute workout.
yeah.
And in the first 5 minutes, I've got my heart rate up, and then I'm not actively, pushing for the rest of the time, but I'm still working out maybe at a lower rate.
Yeah.
And so are you seeing the benefits during that second part where it's reduced even though you just had it up?
Right.
You know, is it, have I missed all of what I was trying to get done, or is it still working? I guess what's that period of time where you get the benefits?
Exactly. Yeah. So thank you.
No problem.
Yes. So you're
Are you trying
describing
to get somewhere?
What?
Were you trying to get somewhere, and then when you were coming home, you were going downhill?
Yeah, what you're describing is interval training, that you're spiking
Yeah.
it straight up and letting it come down and spiking it up and letting
Yeah.
it come down. There's certainly benefits to interval training.
Right.
Yes, so there are benefits to that.
Okay.
And once again, that's yet another tool for health and wellness and fitness. So it's slightly different than what we're discussing tonight, which is achieving this very specific intensity over a given amount of time. But with interval training, you're going to be hitting those intensities, I imagine. Just you're going to be hitting them and then coming off of them and then hitting them again. So long as you're accumulating that, you're going to achieve the health benefits that we talked about tonight.
Okay. Okay. Well, I guess when I do it, it's not really interval training because I only go up the hill once.
And then come down.
Yeah. So I don't keep it up.
Well, that's okay. That's a few minutes towards your goal. So that's a good starting place.
So I'm wondering, this is Carol, I'm wondering, does the app that you use or that you would recommend collect, like if Margaret had a heart rate monitor that she wore throughout the day, does it give you a printout of, I saw the graph, does that give you, you get to see that for your day and you know if you got 30 minutes? Okay.
Yep.
Do you have the name of the app that you use?
The device we have is a Polar, Polar device, and you can just search in the App Store for a Polar app.
Okay.
Okay, thank you.
And that comes with a, okay, so check the App Store for Polar. Okay, thank you.
And even the Fitbits do the same thing. So
Yep.
you know, you can, most of the products that are out there are going to give you the data on it, so you'll be able to track that, you know, within the exercise across the day, you know, and probably the more you spend, the more data you might get, and it'll be more accurate as well. But I think that's something that you should be able to get pretty routinely without having to, you know, stop and measure every few minutes.
Okay, thanks.
Mm-hmm.
Thank you.
These are really good questions. So I guess from here, you know, so I guess the one thing that I'm still curious about, right? So we're doing these things with intensity. We're doing those 5 days a week. There are other things that we can do for different types of benefits. You know, and we talked about all these health benefits that can come out of it, but those seem kind of long term, or they might be subtle, right? If I'm sleeping better, it'll take me a while to figure out that, you know, I've gotten there. So what would you recommend to make like a shorter milestone? Something that you can see those achievable results. You know, everybody wants to see that it's working. What's something that we could put in that short-term category that you can say, okay, this has been working for me, and I can keep going?
Sure. I don't have a great answer. Other than, you know, again, coming back to being goal-oriented, people respond well to being goal-oriented. So maybe shorter term, you give yourself a goal for the next week and you say, okay, this is week 1 of me trying this. I want to see if I can monitor my heart rate and achieve this 2 times this week. I mean, it doesn't mean that you have to start out, you know, at the end goal. You can start out small. And then We also know that people do best when they write their goals down. So again, at Dodd, we actually give people a piece of paper that it's almost like a calendar that has every day of the week on it. And they just give themselves a check if, yes, I got 20 to 30 minutes of exercise in the moderate to high intensity, yes or no. And then you can kind of see like, oh, I got this many days, and then I was lazy for a couple days. And that's generally internally motivating for people to say, I don't want that blank spot on my calendar. I want to have a check there the next day. So I don't know if that helps, Kadar, but that's my recommendation is just starting out. Don't say, I'm going to do this for all of 2021. This is going to be my New Year's resolution. I would start small. Let's get to the end of this week. Let's see if I can track my heart rate one time, between now and next week. And that will be a good first step.
So things like a diary do help, even if you're getting the data printouts from, the whole day, kind of stacking those days if you would, and keeping track of that. Very good. Okay. If anybody else has a question, we'll take the time for it, but if not, then we will conclude. So this was a really great session, Meredith. Thank you so much.
Thanks. I hope you guys
for
learned
asking your questions. Yeah, I think so. I know if I'm looking through this, what are the health benefits? I know that I can get in good health in a lot of different ways. I know how to find my heart rate, though I have to tell you, I can never, ever
find your pulse.
Oh my gosh, I always feel like I'm just like a zombie. I can't get that pulse. I thought the heart rate max was great, and I'm sure some of these tools, apps and tools that are out there can calculate that for you. So that's pretty cool. And I hope everybody out there has one activity that they can think about. I know mine is going to be chasing my kids up and down the stairs.
Yeah. I had a rough week that my health wasn't good. We won't go into it. I wanted to do more this week. I didn't. I will next week, this week, starting today.
Well, so, keep a diary and, we'll see those check marks, right?
Yeah.
So very good. Well, if you're going to join us next week for our social night, I think that'll be a great thing to kind of come back and say, hey, were you able to keep it up? And were you able to, be consistent? And if not, that's okay. And we can see what we can do to work through, how to improve that. So, again, we'll have our last social night of the calendar year next Thursday. I hope you'll join us for that. And then you be on the lookout for more information about what's coming up this spring. So starting in January all the way through May. So we've got some really good stuff, and I really just have to get those flyers done for you. So hope to have those out for you soon. So thank you very much to Meredith, Dr. Banhos, for being here and giving us this really great set of instructions and insights. And for everybody else, have a great night.
Thank you, Kadar.
Thank you.
Have a good one, everybody.